Assalamu alaikum and Bismillah Rahman Rahim. Today we will know about how you can improve the presentation. You can improve the presentation by making preset templates and revising these templates again and again to your colleague, even when the patient is not present. For example, when you are walking along with the colleague from one ward to another ward, you should discuss along with him the templates, and you should not waste the time. For example, you are sitting on the tea, and you should not waste that time. You should discuss with him, and you should start revising these templates. These templates can be made, for example, for the short case. For example, I can explain that when I was doing from going one word to another. For example, I can even remember now how we would present that. For example, for the acromegaly patient, I used to present like this to my colleague. My patient is lying in the bed with the IV cannula. She has a coarse facial features, and there is a frontal bossing, and there is a big nose, a big tongue, and the teeth are male occluded. There is prognathism, there are big ears, and there is thyroid palpable as well. The patient has spade like hands, these are big hands, and there is a tunnel sign positive. The pulse is 110 beats per minute and blood pressure is 160 by 100. The patient has big feet and big toes, and there is a hepatosplenomegaly. So my diagnosis is acromegaly. So even the patient is not present, but I can remember that, and it becomes more polished with repeated and repetition and revision. This is just cramming. You should cram these templates. These templates are readily available in the Rider Mir and Gautam Mehta and ABM Abdullah. These books, these are already printed, and just you have to cram it and revise it. It is not necessary that a patient is present. You can remember it. You should make it on reflexes. When you see the patient, you will automatically remember these templates. You can tailor these templates according to the patient. It is not a very huge problem. So this is the best method. And then the examiner will ask what investigations will you do. Then you will practice such like that. Sir, I will do the following investigations. I will do the X-ray skull lateral view, which will tell me the enlargement of the pituitary fossa, and I will do the x-rays of the hand, which will show the increase bone thickness and bone size, and also x-rays of the feet, which will show the increase bone and fat pad of the heel. Sir, I will do the RBS, which will tell me the increase in the RBS levels, and hemoglobin A1C will be done. The growth hormone level will be done, and insulin like growth factors will be done. And to confirm my diagnosis, I will do the MRI brain, which will show me the increased size of the pituitary fossa. I will also do the visual perimetry. Then the examiner will ask what treatment and how will you manage the patient. Sir, I will do the multidisciplinary approach, involve the neurosurgeon as well, and I will go for the patient education, patient occupational therapy, and general treatment for the diabetes, hypertension control, and specifically I will consult with the neurosurgeon, and they might go for the laser therapy, or the transsphenoidal approach for the removal of the gland. If the patient is not fit for surgery, for the microsurgery of the pituitary gland, then we can offer cabergoline, and the growth hormone receptor antagonist pegvacemant, octreotide, and tamoxifen. Also, linear accelerator, gamma knife, and proton beams are the other treatment modalities available. So just by doing this, you can improve the presentation. Go until the deep, do also the investigation, and discuss also the treatment. So this will completely make a very good template for you, and you can repeat it again and again, and it will improve and your presentation, and it will improve your flaws, and the time will be less wasted, and the examiner will be impressed. Inshallah, we will discuss in the other videos how to improve presentation, and the same technique can be applied to the history as well. So you can make templates for the history, and this can improve your history as well.